for a few years, we've been discussing on how to best risk stratify DLBCL for newer trials with immunotherapy, for example. And there are lots of developments on molecular analysis. You can see the guidance trial, for example, is based on molecular clusterization of DLBCL and other transcriptomic signatures that are all of them very difficult to take into the clinical setting, particularly because this takes time and lymphoma is a very aggressive disease, particularly DLBCL. So there are new ways to need it to better risk stratify these patients. So one of the approaches we have been following during the past 3 years was to try to link histological image to prognostication. And for that, what we have done is we have digitized all the hematoxylin eosin slides from our hospital. These are roughly 500 cases, and we have started to analyze how a digital pathology tool, which actually detects the cell nucleuses and extracts lots of metrics from each cell and from the interaction between the tumor and the microenvironment, how does this correlate with risk? So our initial analysis, which is based on 118 patients, has provided a very strong foundation for the risk stratification of DLBCL. Based on this approach, we've seen very dramatic differences between risk groups predicted by this AI-driven approach based on histological images. And we believe this is a new path to go forward, because actually we need something very fast in the DLBCL, and if you can establish risk accurately with hematoxylin eosin slides that are available from the time of diagnosis, we'll develop these digital biomarkers which can be readily applicable as soon as a new DLBCL patient is diagnosed, and you would not need to wait a little bit until the molecular data and you can start treatment in a clinical trial. So very promising data. Obviously, we need additional validations and to expand our cohort, but this is going to be done.